I would like to stress how much NAMI has done for me and my family. Without them, I don't know where I would be now. I've had some, both my children had mental health challenges as they grew up, and I lost my oldest son a number of years ago and blamed myself, of course, thinking as a mom I should have been able to save him, and I couldn't. And years later, my youngest son started having mental health challenges, and I learned about NAMI through one of his doctors, and I came to NAMI, and it's been a lifesaver. And I love the people that come into our office that we get to talk to and get to share things with when they come in crisis, and they just feel like there's no hope. And I just love to see their face when they leave, when they've got the information, and we've spent a half hour, maybe 45 minutes with them. And, you know, they can see that, wow, they're not the only ones that have gone through things like this. So NAMI is very important to me, very important in my life, and it's a lifesaver for me. Some of the skills that I have that have really helped me with resilience in my life and with my family's life are, I think a lot of it came from the work that I did for a number of years. I was a 911 operator and with Washington County for a number of years. And it takes a special person to do something like that. You have to be able to do a dozen things at one time. And when I was helping somebody or talking to somebody on the phone in crisis, maybe attempting to take their life or something, I go into like a low gear, and it's just everything becomes crystal clear to me, and I find it much easier to help someone rather than panicking or whatever. When my kids were little, when they'd skin their knee or break an arm or whatever, I would immediately go into the helping mode and not screaming and hollering if I saw blood or whatever. And it just kind of gives me a little bit of a way to look at things, and so I can clearly help someone. I love being with NAMI. I love helping people that are in need, and I love especially helping families that are in need, because that's how I came to NAMI, as a family member wanting some help with one of my children. And I came and I went to the family-to-family class, and I learned so much and was so thankful for that. And I haven't left NAMI. I'm still with them because what I do there means so very much to me and very important in my life, and it's my passion. I also have a way, talking about resiliency, a way of kind of stepping back when I'm meeting new people and even people I've already met, and kind of like, I like to listen to people. I don't want to jump in and tell people what they're supposed to be doing, because believe me, I do not have all the answers. I just have, what I have is lived experience with my loved ones that have mental health challenges. Hope is another one of my resiliency skills. I know that there's hope. Originally, I didn't think there was, and I thought that there was no hope for my son. In fact, I thought maybe he'd end up in Oregon State Hospital is where I thought he would end up, and now I know that's not the fact. And I know that with doctors and with the right medication, he's 180 degrees different from what he was when I felt hopeless. So yes, hope is very important, and we have to have hope, or there's nothing.